I'm going to start out with a gross lower extremity range of motion and manual muscle test, including the hip, knee, ankles, and the toes. Hi, my name is Leah. I'm going to be your student physical therapist for today. We're going to start off by doing a couple manual muscle tests. I want you to go ahead and start out by putting your hands behind you just to stabilize you a little bit. Have you ever had manual muscle tests done before?
Yes.
All right, so we're just going to be doing some range of motion and checking your strength a little bit. I'm going to ask you to lift up your right leg up to your chest. All right, back down and lift up to my hand. And go ahead and resist me. Good. And same thing on this side. Up to the chest, back down, and up to my hand. Resist. Good. All right, just relax down and don't let me pull you up. Good. Same thing on this side. Good. All right, go ahead and spread your legs out for me. And don't let me pull you in. Good. Put them together. All right, don't let me pull you out. Great job. All right, and separate out just a little bit for me. Go ahead and tilt your foot inwards and your knee outwards, and don't let me resist you. Good. And as far out as you can go, and don't let me resist. Good. Same thing on this side. And all right, outwards. Good. All right. Now we're going to move on to the knee, so I want you to extend your knee out as far as you can go. All right, and bend it just slightly, and don't let me push you down. Good, same thing on this side, and go down slightly, don't let me push you down. Great job. And now just bend your knees behind the table there. Pull you, and same thing on this side, don't let me pull you. All right, now moving on to the feet, go ahead and press those gas pedals. Don't let me pull you up. Don't let me pull you up. And pull them up. Don't let me push you down. Don't let me push you down. Great job. Turn those feet inward for me. And don't let me push you out. Good job. Same thing here. All right, and outwards. Don't let me push you in. Don't let me push you in. All right. Now I'm going to actually ask you to take off your socks. Perfect. All right. So go ahead and spread out those toes for me. All right, we're gonna see if we can hold those apart for me. Good. All right, and don't let me push those toes down, so keep them up for me. All right, same thing on this side. All right, curl those toes, and don't let me uncurl them. Good. Good. The first manual muscle test I'll be doing is the Thomas test. So what we're testing here is the hip flexors, more specifically the rectus femoris and the iliopsoas. So we want to get the patient in a supine position with both knees tucked in. And what we're looking for in the end is as long as they have a 10-degree extension of the hip and 80-degree bend of the knee, then that is a negative Thomas test. So we're going to start with the Thomas test. It's going to test your hip flexors. I want you to go ahead and start to lean back, and I'll help you out here. Great job. All right, and go ahead and tuck those legs into the chest, and we'll start by lowering the left leg here. All right, and keep that leg nice and tight in there. All right, and we'll try to bend this leg at about 90 degrees. Perfect. And you can see that the leg drops down off of the table. So that is a negative Thomas test. All right, go ahead and bring this leg back up and lower the other one down. And make sure this is at 90 and perfect. So we got at least 10 degrees there visibly. So positive or negative Thomas test. All right. The straight leg raise is testing the length of the hamstrings. So you want to make sure that the leg is straight, and as long as you can get past the 90-degree point without bending the knee, that is a negative straight leg raise test. And a normal end feel would be firm. All right, the next test we're going to be doing is called a straight leg raise. We're going to check the length of your hamstrings or the back of your thigh there. And what we're going to do is we're going to go ahead and straighten this leg out, and we're just going to lift it overhead. See how far we get here. Let me know if you feel any tightness. Guard the knee. Make sure we're not bending there.
That's good.
All right, that's good. Okay, so as we can see, this is about a 90-degree angle. That's a negative test right there. We'll do the same thing on the other side. Straighten that leg, guard the knee, and we're going to lift up overhead. Let me know when you feel some tightness.
That's good.
All right, and that's also right at 90 degrees, so we got a negative test for both. According to our textbook, we're looking at grading manual muscle tests in 5 different levels. So a 5 is normal, they can go through the full range of motion, and they can resist against maximum force. Then a 4 would be good, so they can still go through the range of motion, but they can only provide resistance against moderate pressure. And then a 3 is fair, and that would only be they can just hold the test position. Whereas a 2, they can't hold against gravity, so they have to be put in a gravity-eliminated position, but they can get full range of motion in that position. A 1 is no movement present, but you're able to palpate a trace or a twitch of the muscle. And a 0 is absolutely no movement at all and no twitch. For our first manual muscle test, we're going to be looking at the hamstrings by doing some knee flexion. So for patients that are able to provide resistance and they have pretty good range of motion, we're going to have them in prone, and we will provide the resistance at the back of the ankle, and then we will have one hand to stabilize on the hamstrings. If they're not able to do that, then we will get them into the side-lying position and we'll hold their limb up as they move through the knee flexion range of motion. If there's no movement still, we're going to move down to a 1 or a 0, and we're going to have them back in prone to feel if there's any muscle activation at all in the hamstrings. The next thing we're going to be testing is your knee flexion, so I want you to go ahead and lay on your stomach for me, face down, with your feet hanging off the edge of the table, and we're going to make sure that you have full range of motion, so go ahead and bend your knee all the way, good, and we're going to bring you down to about a 45-degree angle. I'm going to place a hand on the back of the ankle here and one on the hamstrings here. And I want you to go ahead and resist me. I'm going to push this leg down. Ready? Mm-hmm. Here we go. Good. All right, relax. Now for tibialis anterior, we're going to have to do 2 motions, dorsiflexion and inversion. If the patient is able to provide resistance, they'll be at a 5 or a 4. And we will have them in sitting, and we will plantar flex and evert them. Then if they are not able to provide that resistance, we want to see if they can hold the test position and still in sitting, still dorsiflexed and inverted. If they cannot hold that, then we want to see if they can activate at least the tibialis anterior by trying to do that motion. The next thing we're going to be testing is the tibialis anterior muscle. We're going to be doing that by dorsiflexing and inverting the foot. So go ahead and place your foot on my thigh here, and I want you to bring your foot up and go ahead and turn it in for me, and I want you to resist me, okay? All right, so she went straight down as soon as I applied resistance, so I would give that a 3. The next manual muscle test is looking at hip extension, and more specifically gluteus maximus and the hamstrings. So if the patient is able to provide some resistance, they're a 5 to a 3, then you're going to have them in prone and you're going to resist them facing down. Whereas a 2, if they're not able to go through that full range of motion, you're going to put them into side lying and you're going to carry their leg through that range of motion. Lastly, if they have a 0 or a 1, if they don't have any movement in either of those first 2 positions, then you want to lay them back in prone and see if you can feel for any muscle activation. All right, so since we were unable to get full range of motion against gravity in the test position, we're gonna go ahead and move on to the second position for a 2. So for hip extension, I want you to go ahead and lay on your side. Go ahead and face that way for me. So I'm gonna stand behind her, and I want your bottom knee to go ahead and be bent. Good, and then top leg straight. So we're gonna move you through this range of motion. I'm just gonna hold you up, and then I want you to move through. I'm gonna guard this crest of your hip right here, and I'm gonna hold this leg right here. I want you to go ahead and move through your extension range of motion, and I'll support the limb.
That's good.
All right, good, and you can come on back. Perfect, and lower back down. We're going to be looking at range of motion for internal and external rotation of the hip. And so a normal range of motion for both is 0 to 45 degrees, and they both have a firm end feel. Now, when your patient is doing this, you want to make sure that they're not hiking their hip or flexing the hip at all, because that could throw off your measurement. Now we're going to be taking the range of motion, external rotation and internal rotation. So we're going to start off by placing a towel under the distal part of the femur. So go ahead and lift up here and relax. All right. So we're doing that just to make sure that everything is horizontal. We're going to be taking external and internal rotation of the hip. The fulcrum is going to be at the center of the patella. The proximal arm is going to be perpendicular to the floor, and our distal arm is going to be along the midline of the tibia. So I'm going to go ahead and line this up, and we are going to start you off by bringing your foot in, the knee out, and we're going to realign that fulcrum, make sure everything's perpendicular with the floor, and we're going to line that up with the tibia right there, which we get approximately 30 degrees. So now we've done the external rotation. Now I'm going to do passive rotation of internal rotation of the hip. So same fulcrum, same proximal, same distal arm. And now I'm going to move her through the range of motion. It helps if I can get a leg in here. And we're going to make sure that she's not hiking the hip. So that's where I feel that firm end feel. I'm going to go ahead and align the fulcrum here, and then we're going to go perpendicular to the floor, and we're going to measure central to the tibia, and we get about an angle of about 41 degrees. So we're going to be looking at the talocrural joint for our ankle range of motion. And this joint is capable of doing plantar flexion and dorsiflexion. So normal end feel for plantar flexion is firm or hard, and the normal range of motion is anywhere from 0 to 45. And then for dorsiflexion, we are going to have a firm end feel and a normal range of motion of 0 to 20. All right, now we're going to be working on active and passive range of motion of the foot. So we're going to be doing active range of motion for dorsiflexion and passive for plantar flexion. So our fulcrum is going to be the lateral malleolus. Our proximal arm is going to be lined up with the midline of the fibula up to the fibular head. And then our distal arm is going to be parallel to the base of our fifth metatarsal. All right. And then let's get you into neutral position. So we're going to start our goni at 0. Make sure that we're lined up with the base of the fifth there. All right. And I want you to actively, so go ahead and bring that foot up for me as far as you can. All right. Perfect. And we get about 21 degrees. So now we're going to passively plantar flex. So we want to get realigned in that neutral position. Perfect. All right. And I'm going to plantar flex the foot here. Till we get a firm end feel. And I would say that's about it right there. And we are still parallel with the base there. And we're still pointing up at the fibular head. So we get approximately 64 degrees.
Shika Patel, and I agree that Talia Brenan has met all the skill requirements. My name is Shika and I approve this message.
Hi, my name is Talia. I'm a physical therapist. Nope. Alright, relax. And we can test the other side as well. Alright. It's a miracle.